it's been a long time coming progress for sickle cell disease, but I'm pleased to say that there's a whole range of drugs, gene therapy, gene editing interventions, either sort of approved already or on the way through the pipeline, and I think this is going to be a very exciting next 5 to 10 years for sickle cell, and hopefully the treatment paradigms will be entirely different within a short space of time. We've got to remember that really we've had hydroxycarbamide, which is a very effective drug, but doesn't work for everybody and doesn't work completely. Or transfusion, which again is effective, but quite a burden for patients, and there are risks associated with transfusion as well, in terms of allow antibody development, and a proportion of our patients become almost untransfusible, or every transfusion becomes a large risk for them. So we have to have other opportunities to treat them. As I said, it's a very difficult disease to live with. Many patients exist in a sea of pain and discomfort, punctuated by only sort of brief islands of respite. Their lives, their education, their relationships, their ambition, their opportunity is hugely stifled by this disease. And as they get older, there's a progression to a more of a pattern of multiple chronic organ disease and potentially failure, and drastically shortened life expectancy. So we have to think of sickle cell disease not just as the disease that causes severe and unpredictable pain for patients, but we have to also think of what things look like 10, 20, 30, 40 years into somebody's life. And the long-term consequences of a lifetime of sickling on organ function. So diseases which treatments which have potentially the possibility of modulating those and improving that background pathogenesis of sickle cell disease and reducing organ damage are essential. So we've got pyruvate kinase agonist drugs. We've got the recently approved Crizanlizumab in the UK, which is now starting to be rolled out, which should reduce, hopefully, pain and the suffering that these people have. But we don't know much yet about their long-term benefits. I think the most exciting for me, again, relates to, in a similar theme to the transplantation, it relates to treatments which might cure the disease, and so I'm very interested to see how things pan out over the next couple of years regarding particularly the gene editing product, the gene edited product, which I think is a very exciting development. I think inevitably there will be some work on adjusting conditioning regimes for these patients to reduce that toxicity. But yeah, all in all, an extremely exciting time. It's not been an area of haematology that has always been hugely attractive to trainees, and I really hope that is changing now, and that my younger colleagues and trainees will see the excitement and the opportunity in this field, and really give it their consideration for a longer career.